Good morning, Chairman Stark and Lewis, Ranking Members Herger and Bustani, and distinguished members of the Subcommittees on Health and Oversight. Thank you for the opportunity to describe the Department of Justice's efforts to root out, prosecute, and prevent healthcare fraud. We are grateful for the Subcommittee's leadership and continued interest in this very important topic. Every year, hundreds of billions of dollars are spent to provide health security for American seniors, children, and to the poor and disabled. We have a duty to ensure that taxpayer funds are well spent and that our citizens who receive treatment paid for by Medicare and other government programs are receiving proper medical care. While most medical providers and healthcare companies are doing the right thing, unfortunately, billions of dollars that could be spent on patient care are lost each year to fraud schemes. This is unacceptable. For these reasons, the Department of Justice has redoubled its efforts, together with our partners at the Department of Health and Human Services, to protect the public from healthcare fraud and to help ensure the integrity of patient care. Because coordination across agencies is an integral part of preventing and prosecuting healthcare fraud, Attorney General Holder and Secretary Sebelius together pledged to strengthen our fight against waste, fraud, and abuse in Medicare. In May 2009, they announced the creation of the Healthcare Fraud Prevention and Enforcement Action Team, what we refer to as HEAT, a senior-level joint task force which the Deputy Attorney General oversees, along with his counterpart, the Deputy Secretary at HHS. This is designed to marshal the combined resources of both agencies in new ways to combat all facets of the healthcare fraud problem. In just 1 year since we announced HEAT, we have had some remarkable successes. We expanded the Medicare fraud strike force teams last summer from 2 to 4 cities, and in December expanded into 3 more cities. The strike force prosecution model involves analyzing Medicare data to identify fraud hotspots of unexplained high billing levels that, combined with field intelligence from our law enforcement agents and investigators, help expedite healthcare fraud investigations and prosecutions. Strike force teams are now operating in 7 locations: South Florida, Los Angeles, Detroit, Houston, Brooklyn, Baton Rouge, and Tampa. In total, since the announcement of HEAT last May, strike force prosecutors have filed over 120 cases, charging more than 290 defendants with criminal charges. Just as important to these efforts, we have seen that these enforcement actions have a significant deterrent effect on fraud. In the first 12 months following the announcement of strike force operations in the Miami area, there was an estimated reduction of $1.75 billion in durable medical equipment claim submissions and a decrease of $334 million in DME claims paid by Medicare compared to the preceding 12-month period. And the strike force cases are only part of the many healthcare fraud prosecutions we have brought as a department. HEAT has also focused on civil fraud enforcement under the False Claims Act and the Anti-Kickback Act. During fiscal year 2009, the department's efforts to combat healthcare fraud accounted for $1.6 billion in civil settlements and judgments. During this same time period, the department opened 886 new civil healthcare fraud matters and filed complaints or intervened in 283 civil healthcare fraud matters. Last fall, Pfizer Inc. and its subsidiary agreed to pay $2.3 billion to resolve criminal and civil liability arising from the illegal promotion of certain pharmaceutical products. This is the largest healthcare fraud settlement in the history of the department and the largest criminal fine of any kind imposed in the U.S. Another goal of HEAT is to provide more effective legal authorities to improve our healthcare fraud prevention and enforcement efforts. The Affordable Care Act of 2010 moves us a long way toward attaining this goal. The new law provides excellent means through which the department and HHS can and will increase prosecutions, seek increased penalties for criminals, prevent those who seek to commit fraud from getting into the system in the first place, and recover more American taxpayer dollars that would have been lost to fraud and abuse. My testimony describes in greater detail the key activities of each of our components and highlights recent accomplishments. We look forward to working with Congress as we continue this essential mission, and I would be pleased to answer any questions you may have.